Hello. So I was reading this abstract that I found very interesting and had some thoughts and ideas about it that I wanted to share with you guys, just to kind of think about complex DBS programming using the directional lead. So this paper is talking about what they're calling a vertically stacked single segment activation. I'll explain what that is in a minute as a programming approach for directional DBS in GPI. And it's a first clinical case series. Basically, it's 4 cases with 7 leads. So one of the case probably have a unilateral lead implanted that they're discussing, and it's Parkinson's disease and it's GPI lead placement. These are directional leads. This is by the Georgetown team. You can see Dr. Fernando Pagan is a senior author here. It's basically the Georgetown team here. Faz Amjad is there. And then Abbott is collaborating. So you see Srivastan Pallavaram, which is from Abbott, that is part of this abstract. So it's interesting that what they're describing is that when they programmed the patient to find the best therapeutic window and the best benefit, they ended up with patients who had this what is a double monopolar stimulation by using a segment. So we know about this stimulation. We can have you have 4 rings, you can activate 2 of those rings, and now you get 2 monopolar 2 balls that basically are stimulating to one side. Now, traditionally, what we have thought about use of a segment stimulation, or one of the 3 segments on the ring, is to turn one segment on, and what happens is the current is kind of shifted slightly towards that segment and moving away from the bad area towards the good area. But we could probably come up with very complex shapes by using these different segments and different combination, and all of them can be activated as positive or negative. So in their patients, what they ended up with, in 6 out of these 7 leads, they ended up with 2 of the segment on top of each other, stimulated as a double monopolar stimulation. So it's almost like a ring double monopolar, but only one segment on the 2 rings. But the segments were stacked on top of each other, because if you think about it, you can have a double monopolar segmented stimulation with one segment on one side, let's say 2C and 3A, and now you have 2 separate opposite segments stimulating, vertically separated and also horizontally separated. But they basically are getting this vertical column stimulation in 6 out of their 7 patients. Which is interesting. It's GPI, so maybe they need a more area stimulation, and actually they are reporting in conclusion that there is some element of GPE stimulation that is probably required or probably happens when we stimulate. And what they were reporting was that based on the calculation of the tissue activation volume using the SIM4 Live version 4 and MIDA model, they are finding that 90% of the stimulation is in the GPI and 10% stimulation is in GPE and lamina being stimulated. But what it got me thinking about really complex kind of stimulation using various different combination of segments to get a very complex shape. So, for example, they report that the 7th lead out of the 7 lead required a very complex shape, and they're saying that it was a complex bipolar montage with activation of 4 negative, so top negative, then 3C negative on one side, then 2C negative below it, 2C positive below it, and 2B positive. So they have 4C negative, then they have one segment of 3C negative and a positive segment right below it as 2C, and also a positive segment behind it 2B, creating a complex bipolar shape that is only possible with a directional stimulation. So very interesting thought on how we can shape it. I'm still puzzled on how much benefits you can get by shaping the current complexly to get to certain areas and not get to the other areas, in terms of increasing the therapeutic window, getting benefit at a lower stimulation and side effect a higher stimulation, as contrast to the other techniques that we use, for example, use of the pulse width. And interestingly, they use a pulse width average of 67 microsecond, closer to 70 microsecond, which is more typical stimulation that we typically do, and not like a 30 or 40 microsecond low stimulation, low pulse width, to get a more therapeutic window based on some other papers that we have seen recently, to get this. And they also were using high frequency of a mean frequency of about 153 hertz, or 150 hertz stimulation, which again is a high frequency stimulation being used in GPI. It's just an interesting paper I thought I'll share with you guys. And let's keep sharing with information with each other using these online tools more often. Good to see you guys.